Hi, this is Cindy with Essential Therapies, and I'm just going to go over a handful of exercises for those who may need to bring some awareness back to the muscles, especially of the lower body. So we're going to start with just some quadricep sets. We call them quad sets. It's really working on the muscles on the top of the thigh. They work the knee. So their function is to take the knee from a bent position and to straighten it. One of the many functions. We're going to keep it simple with you for that right now. So what we're going to do is put something underneath the knee that's bolstering it a little bit. Not too much, but just enough so there isn't any discomfort. Now if you feel fine without anything, that's okay too. But I'm going to have you put your hand on the quadriceps or on the top of the thigh so that you can feel what's happening. And when you feel that muscle tighten or get hard underneath your hand, or feel firm, or even just move, that's an indication that the muscle is contracting, okay? So if you have your hand here, it's like a biofeedback device giving you that feedback right away. And as you're thinking that you want this to become very hard and firm, then you're actually telling those muscle fibers here to kick in a little bit more. So it doesn't look like much, but you're just pushing the knee down into whatever you have here. Hold, holding it for a good 3 to 5 seconds is best. You're gonna feel that muscle be hard that whole time, and then soften and relax. So press the knee down. As you do that, you may feel or see the foot rise up. That's okay. Hold, and relax. Now you could do both legs at the same time. So I'm gonna move around here a little bit. I'm gonna put both knees here. Now, if you can't comfortably sit without your back against something, then you could sit against the wall or against a sofa or something so that you could have some support back here. And again, you really wanna watch if you're really hunched over, that's not good for your posture either. So if you're doing both legs at the same time, the benefit of that is if one leg is stronger than the other, it kind of helps the other leg if you're doing them at the same time. So you push down, feel both quads working, hold, and relax. Press down, hold, and relax. Now, the next question is always, how many of these do I do? So it kind of depends on where you're at, but if this is challenging for you, you're going to do as many as you can comfortably. You're going to notice if that muscle starts to let go after a few seconds. You really want to try to increase that endurance over time. But if you can tell that after 3 seconds it's kind of starting to soften a little bit, then just do it for 3 seconds. And as it gets stronger, you'll notice that change and the muscle will be able to stay tight longer. And if it feels really easy for you, then 15 times, 30 times, and remember, don't rush it because we really want to get a quality contraction here. Hold, and then relax. Hold, and then relax. So if you're doing these with me right now, just pause the video and go ahead and do as many as you comfortably can. Okay, let's move along. You can also do what we call short arc quads in the physical therapy world. We're gonna make this bolster even higher underneath the knee. And this time you're not thinking about pushing the knee down, but you're thinking of lifting the foot up and the leg stays on the bolster. So it looks like this. Just lifting the leg up. Very similar to the other one, but it's a different focus of your thought and what's happening. So here I'm thinking of lifting the foot and I'm going to hold it also. I could even add some dorsiflexion, pulling the toes back to get the front of the shin here, and then lower down. And you'll feel this working here in the quadricep also. You can do these laying down, that's totally fine. If you lay down though, you can't feel yourself here, that's okay. Whatever is most comfortable for you. So again, maybe you can only tolerate 5 of these at a time, that's okay. Maybe you're doing 15, 20, or even up to 30. We're working on endurance. If that's the case, then that's okay as well. Okay, so really working on the quad here. So we're gonna take that now to your side. This is a little bit more hip movement. You're going to rest yourself. You can use a pillow for your head. If it's not uncomfortable for you, you can put your hand here and think about your trunk and your pelvis. You don't want it to be rolling back. You don't want it to be really rolling forward. You're really on your side, and think about bringing that belly button in toward the spine, or maybe even focusing on neutral spine if you know what that is. And you'll see in this position, see how I'm cranking my head up? It's giving me a stretch here. And actually I'm kind of tight in my neck side bending, so I'm leaving this here for now because it's comfortable for me. But if it's not comfortable for you, you definitely want to come down onto a pillow. Okay, so the bottom knee stays bent. Keep the legs straight, and you're just going to go side leg raising here. So nice and comfortable, slowly up, slowly down, hold, and down. Okay, as much as you comfortably can. Pause here if you want to do some more. And then while you're still in this position, we're going to change it up. We're going to take the bottom leg, straighten it out. We're going to lift that bottom leg up. Doesn't need to be a huge amount. You're going to come up and down. If this is uncomfortable with the leg behind you, bring the leg in front. Up and down. Up and down. Okay, so pausing here so that you can do more, and then we'll give you a different position. That was a cattail. So from here, we're going to switch over and do the other side. So again, on your side, hi Tommy, and lifting up and down. So we're working the muscles on the side here. You could even put your hand here and see if you can feel things work. There are a few different, hello there. This is Tommy. And pausing the video so that you can add more. Then we're going to switch to work the inner thigh. So you can have the foot behind or in front, whatever feels better for you. Mine actually feels better behind. So you're going up and down. And don't worry about lifting really high. The idea is just to get some activation here. You're working on these muscles on the inner thigh. Okay. Now from here we're going to do clam shells. I did not plan this, I promise. He's just photogenic, I guess. Take the feet together, and just, I like to imagine that they're glued together right here. And you're going to keep your body straight up and down, so you don't want your pelvis to roll back. Keep it straight up and down, the hips are stacked. And you're just going to lift this knee up. So there's a rotation happening in the hip to do this. Nice and slow and down. Think of pulling the belly button in toward the spine. And doing several of these. Again, use your body as the clue of how many you should do. So if you're feeling like you're struggling and you're at number 8, see if you can do a couple more, but if that form starts to go, it's time to take a break and rest. Okay, so I'm going to turn around to do the other side. Pause if you need to do more. And then going back to here, clamshells on this side, bottoms of the, or sides of the feet together, and again, keeping the hips stacked. You get the idea. Okay. It's really helpful to tune into your body while you're doing these and to make sure you can really feel the muscles working. Okay. So now we've done the front of the thighs, the sides, the inner thigh, some rotators. Now we're going to work on the glutes and the hamstrings, the muscles in the back of the body. So we're going to come down onto your front side. Okay, and it should be comfortable to be here. You may want to rest your forehead on your hands like so. If you have some discomfort in your back or your hips, you might take a folded blanket and put it underneath the front of your hip area. So in this space, we get very tight from sitting a lot during the day or just the way our lives are. And the tissues that are deep inside the pelvis come up and attach to the front side of the vertebrae. So when we lay flat, there may be a tug there if there's a lot of tightness in your hip flexor area. So if you take a blanket, you can try different ways, maybe make it nice and wide under that area, or maybe more focused right under the hip crease. Whatever works for you. See how that's kind of getting my hip a little bit more bent here. Or if it's too much, make it a little more flat so that it goes a little higher up onto the belly. And that feels really comfortable here too. So just in this position, you're gonna start with your head relaxed, and then you're going to bring one heel up towards your buttocks, and then bring it back down. So just that movement alone works the hamstring. Bends the knee, I can really feel that muscle work, and then lower it down. You should feel the muscle relax. Feel it tighten, and then relax. Now sometimes people will begin to get a hamstring cramp here, so go very cautiously and don't worry about bending in really far if you're worried about that. Also, if there's a lot of tightness on the front of the quadricep area and the hip flexor area, this might feel tight when you do it. So just go gently, okay? So do several on one side and then switch to the other. And pausing the video so that you can complete however many repetitions you need. Remember to keep your focus on the muscle group that's working. Right here, it's fine, guys. So really feeling that hamstring work. Then from here, we're going to work on just tightening the glutes. So in the very first exercise we did quad sets, well these will be glute sets. So you're just tightening the buttocks, tight, tight, tighter, and then relax. Tight, tight, tighter, and then relax. And it's a good idea to feel this once in a while to see if your glutes are actually activating, because it's very common. I see this all the time where maybe one side is kicking in really well and the other side isn't, or maybe both sides aren't kicking in really well. So you can just put your hand on your bum, tighten, tighten, tighter, and then relax. And you should feel it move. You can actually see it here. Tight, tight, tighter, and then relax. And make sure you're testing both sides. Tight, tight, tighter, and relax. And then holding that contraction for at least 3 seconds, 3 to 5 seconds is great. And then relax. And really being aware, feeling that muscle tighten and feeling it relax, okay? So now you're gonna rest down a little bit. And you could have your head down with all of those, by the way. From here, we're going to lift the leg up. So this is hip extension. We're using the hamstrings in the back of the leg and the glute muscles. So don't worry about how high up you lift the leg. You can even just imagine lifting the thigh enough to slide a piece of paper under there. And maybe it doesn't even come up enough for a piece of paper, and that's okay. The idea is we just want to activate those muscles. So you're lifting up and relaxing down. And you can even think of your pubic bone, just gently pressing that down a little bit so that you're grounded, up and relax. And then switching to the other side, pausing the video to get however many repetitions you need in. Okay, so if those are going well for you and there's no problem there, you could try this one. It's a little bit more advanced. I find it a little bit harder for people to do, but give it a try. You have your foot flexed, your knees bent, and you're just lifting up from here. Hold and relax. Hold and relax. So do you see how this part of the thigh is lifting up? So the hip joint right here is stretching in front. So we call this movement hip extension. So we're extending the leg back. We're opening the front of that hip joint. And for some people, this can be a little uncomfortable if there's a lot of tightness throughout the front side of the low back, reaching down into the hip. So take it slow and easy. Listen to your body. Don't do too many reps if it's uncomfortable, and if you're sore the next day, that's okay. We need to have a little bit of soreness for our bodies to adapt. It just is telling us that everything is moving along the way it should. The muscles actually work really hard to do these, and when they're not strong enough to do them, you will get some soreness sometimes for a couple of days. But that's the body's cue that it needs to build up that musculature more. So it's all a good thing. So give those a try. Remember, don't ever force, don't cause any pain, and be consistent and patient. Have a great day.